1. A patient with type 1 diabetes reports feeling shaky and sweaty. Their blood glucose level is 45 milligrams per deciliter. What is the nurse's priority action? Answer. Administer 15 grams of fast-acting carbohydrates, such as 4 ounces of orange juice. Rationale: hypoglycemia, blood glucose, less than 70 milligrams per deciliter, requires immediate administration of 15 to 20 grams of fast-acting carbohydrates to raise blood glucose levels. Symptoms like shakiness and sweating indicate the need for prompt intervention to prevent complications like seizures. 2. A nurse is preparing to administer insulin Lispro, Humalog, to a patient with type 2 diabetes. When should this medication be given? Answer: within 15 minutes before or immediately after a meal. Rationale: Lispro is a rapid-acting insulin that begins working within 15 minutes. Administering it close to mealtime prevents postprandial hyperglycemia, while minimizing the risk of hypoglycemia before eating. 3. A patient with diabetic ketoacidosis, DKA, has a blood glucose level of 450 milligrams per deciliter and a serum potassium of 5.5 milliequivalent/L. What should the nurse monitor for during insulin therapy? Answer: hypokalemia. Rationale: insulin therapy for DKA drives potassium into cells, potentially causing hypokalemia. Monitoring potassium levels is critical to prevent arrhythmias or other complications. 4. A patient with type 2 diabetes asks why they need to inspect their feet daily. What is the nurse's best response? Answer: to check for cuts or sores that could lead to infections. Rationale: diabetes can cause neuropathy and poor wound healing, increasing the risk of foot infections. Daily inspection helps detect issues early to prevent complications like ulcers or amputations. 5. A nurse is teaching a patient with type 1 diabetes about managing hyperglycemia. Which symptom should the patient report immediately? Answer: fruity breath odor. Rationale: fruity breath is a sign of diabetic ketoacidosis, DKA, a life-threatening complication of hyperglycemia. Immediate reporting ensures timely intervention to prevent severe outcomes. 6. A patient is prescribed metformin for type 2 diabetes. What instructions should the nurse include? Answer: take the medication with meals. Rationale: taking metformin with meals reduces gastrointestinal side effects like nausea and diarrhea, improving adherence and effectiveness in controlling blood glucose. 7. A patient with diabetes presents with a blood glucose level of 350 milligrams per deciliter, lethargy, and confusion. What is the nurse's priority action? Answer: administer 4 fluids and insulin as ordered. Rationale: these symptoms suggest hyperglycemic hyperosmolar state, HHS, or DKA. For fluids and insulin correct hyperglycemia and dehydration, stabilizing the patient's condition. 8. A nurse is educating a patient with diabetes about exercise. What precautions should the patient take to prevent hypoglycemia? Answer: check blood glucose before exercising and carry a carbohydrate snack. Rationale: exercise can lower blood glucose levels, risking hypoglycemia. Monitoring levels and having a snack available ensures safety during physical activity. 9. A patient with a diabetic foot ulcer is instructed on wound care. What indicates the need for immediate medical attention? Answer: redness, swelling, or foul odor from the wound. Rationale: these signs suggest infection, which can rapidly worsen in diabetic patients due to impaired immune response and poor healing, requiring urgent intervention. 10. A nurse is assessing a patient on insulin glargine, Lantus. What should the nurse clarify with the patient about this medication? Answer: it should not be mixed with other insulins in the same syringe. Rationale: glargine is a long-acting insulin with a unique pH that can precipitate if mixed with other insulins, reducing its effectiveness and causing unpredictable glucose control. 11. A patient with type 2 diabetes is prescribed glipizide. What should the nurse teach the patient about this medication? Answer: take it 30 minutes before breakfast. Rationale: glipizide, a sulfonylurea, stimulates insulin release and is most effective when taken before meals to control postprandial glucose levels. 12. A patient with a blood glucose of 60 milligrams per deciliter is alert. What should the nurse administer? Answer: 15 grams of fast-acting carbohydrates. Rationale: for mild hypoglycemia in an alert patient, 15 grams of fast-acting carbohydrates, like juice, raises glucose safely. Recheck glucose after 15 minutes. 13. A nurse observes a patient injecting insulin into scar tissue. What should the nurse teach the patient? Answer: rotate injection sites to avoid lipohypertrophy. Rationale: injecting into scar tissue, lipohypertrophy, impairs insulin absorption, leading to poor glucose control. Rotation ensures consistent absorption. 14. A patient with diabetic neuropathy reports numbness in their feet. What is the nurse's priority teaching? Answer: inspect feet daily and wear protective shoes. Rationale: neuropathy reduces sensation, increasing injury risk. Daily inspection and proper footwear prevent unnoticed wounds and complications. 15. A patient with type 1 diabetes has a blood glucose of 300 milligrams per deciliter and ketones in their urine. What is the nurse's priority action? Answer: notify the healthcare provider and prepare to administer insulin. Rationale: high glucose and ketones indicate diabetic ketoacidosis, DKA. Prompt insulin therapy and provider notification are critical to correct acidosis. 16. A nurse is caring for a patient receiving insulin for hyperglycemia. What should the nurse monitor closely? Answer: blood glucose and potassium levels. Rationale: for insulin lowers glucose and drives potassium into cells, risking hypokalemia and hypoglycemia. Close monitoring ensures patient safety. 17. A patient asks why they need to monitor blood glucose at home. What is the nurse's best response? Answer: to adjust treatment and prevent complications. Rationale: home monitoring helps patients track glucose trends, enabling timely adjustments to diet, exercise, or medication to avoid hypo or hyperglycemia. 18. A patient with diabetes develops a small blister on their heel. What should the nurse advise? Answer: keep the area clean and avoid popping the blister. Rationale: popping blisters increases infection risk, especially in diabetes. Keeping the area clean promotes healing and prevents complications. 19. A patient with type 2 diabetes is started on insulin detamir, levemir. When should the nurse expect its peak effect? Answer: it has no pronounced peak. Rationale: detamir is a long-acting insulin with a steady effect over 24 hours, reducing the risk of hypoglycemia compared to peak-acting insulins. 20. A nurse is teaching a patient about managing hypoglycemia. What should the patient do after consuming 15 grams of carbohydrates? Answer: recheck blood glucose in 15 minutes. Rationale: the 15 to 15 rule requires rechecking glucose after 15 minutes to ensure it rises above 70 milligrams per deciliter, guiding further treatment if needed. 21. A patient with diabetes reports frequent nighttime hypoglycemia. What should the nurse suggest? Answer: eat a bedtime snack with protein and complex carbohydrates. Rationale: a balanced snack stabilizes overnight glucose levels, preventing hypoglycemia by providing a slow-release energy source. 22. A nurse is preparing to administer NPH insulin. What should the nurse do before drawing up the dose? Answer: gently roll the vial to mix the insulin. Rationale: NPH is a cloudy insulin requiring mixing to ensure uniform suspension, preventing inaccurate dosing and poor glucose control. 23. A patient with type 1 diabetes is confused and has a blood glucose of 650 milligrams per deciliter. What is the nurse's priority? Answer: administer 4 fluids and insulin as ordered. Rationale: confusion and extreme hyperglycemia suggest DKA or HHS. 4 fluids and insulin address dehydration and high glucose to stabilize the patient. 24. A patient with diabetes asks about alcohol consumption. What should the nurse advise? Answer: drink in moderation and with food. Rationale: alcohol can cause hypoglycemia, especially if taken without food. Moderation and pairing with meals reduce this risk. 25. A nurse notices a patient's insulin pen is cloudy. What should the nurse clarify? Answer: whether it is NPH insulin or another type. Rationale: only NPH insulin pens are cloudy. Other insulins, e.g., glargine, are clear, and using the wrong type affects glucose control. 26. A patient with diabetic retinopathy asks about vision care. What should the nurse recommend? Answer: schedule regular eye exams with an ophthalmologist. Rationale: retinopathy can progress without symptoms. Regular exams detect changes early, preventing vision loss. 27. A patient with type 2 diabetes has a blood glucose of 80 milligrams per deciliter before a meal. What should the nurse do? Answer: encourage the patient to eat their meal. Rationale: a glucose of 80 milligrams per deciliter is within normal range, 70 to 130 mg/dl pre-meal. Eating prevents hypoglycemia during activity or fasting. 28. A nurse is teaching a patient about insulin storage. What is the correct instruction? Answer: keep unopened vials in the refrigerator. Rationale: unopened insulin remains stable when refrigerated. Open vials can be kept at room temperature for up to 28 days. 29. A patient with diabetes reports burning pain in their legs at night. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: burning pain is a common symptom of diabetic neuropathy caused by nerve damage from chronic hyperglycemia, requiring assessment and management. 30. A patient with a blood glucose of 55 milligrams per deciliter is unresponsive. What is the nurse's priority action? Answer: administer glucagon intramuscularly. Rationale: an unresponsive hypoglycemic patient cannot swallow carbohydrates. Glucagon raises glucose by releasing stored glycogen, stabilizing the patient. 31. A nurse is educating a patient on diabetic foot care. What should the patient avoid? Answer: soaking feet in hot water. Rationale: hot water can cause burns, especially with neuropathy, and soaking increases infection risk by softening skin. 32. A patient with type 1 diabetes misses a meal after taking insulin aspart. What is the nurse's concern? Answer: risk of hypoglycemia. Rationale: aspart is rapid-acting, lowering glucose quickly. Missing a meal after injection increases hypoglycemia risk due to unopposed insulin action. 33. A patient with diabetes has a blood glucose of 200 milligrams per deciliter 2 hours after eating. What should the nurse do? Answer: document the finding and monitor for trends. Rationale: a postprandial glucose of 200 milligrams per deciliter is elevated but not critical. Monitoring trends guides adjustments to therapy without immediate intervention. 34. A nurse is teaching a patient about sick day management with diabetes. What is a key instruction? Answer: continue insulin and check glucose frequently. Rationale: illness increases glucose levels, requiring insulin continuation and frequent monitoring to prevent DKA or hyperglycemia. 35. A patient with diabetes has dry, cracked skin on their feet. What should the nurse recommend? Answer: apply moisturizer but avoid between toes. Rationale: moisturizer prevents cracking, reducing infection risk. Avoiding between toes prevents fungal growth due to trapped moisture. 36. A nurse is reviewing a patient's insulin regimen. The patient takes insulin glargine at bedtime. What is its primary purpose? Answer: provide basal glucose control. Rationale: glargine is a long-acting insulin that maintains steady glucose levels throughout the day and night, mimicking basal insulin secretion. 37. A patient with type 2 diabetes reports nausea after starting metformin. What should the nurse suggest? Answer: take it with food or ask about extended release. Rationale: taking metformin with food reduces GI upset. Extended release formulations may further minimize side effects, improving tolerance. 38. A patient with diabetes presents with rapid breathing and dehydration. What should the nurse suspect? Answer: diabetic ketoacidosis, DKA. Rationale: rapid breathing, Kussmaul respirations, and dehydration are classic DKA signs, requiring urgent assessment and treatment. 39. A nurse is teaching a patient about carbohydrate counting. What is the goal of this strategy? Answer: match insulin doses to carbohydrate intake. Rationale: carbohydrate counting helps patients with type 1 diabetes calculate bolus insulin doses, improving glucose control and flexibility. 40. A patient with diabetes asks about preventing hypoglycemia during exercise. What should the nurse advise? Answer: check glucose before and after exercise and adjust snacks. Rationale: monitoring glucose guides snack timing and quantity, preventing exercise-induced hypoglycemia by maintaining stable levels. 41. A patient with type 1 diabetes is admitted with a blood glucose of 500 milligrams per deciliter and abdominal pain. What should the nurse prioritize? Answer: assess for diabetic ketoacidosis and notify the provider. Rationale: high glucose and abdominal pain suggest DKA, a medical emergency. Prompt assessment and provider notification ensure timely treatment. 42. A nurse is teaching a patient about insulin aspart novolog. What should the patient know about its onset? Answer: it begins working in 10 to 20 minutes. Rationale: aspart is a rapid-acting insulin, requiring administration just before or after meals to match postprandial glucose spikes. 43. A patient with type 2 diabetes has a blood glucose of 65 milligrams per deciliter and is alert. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia in an alert patient requires 15 grams of fast-acting carbohydrates to raise glucose, followed by rechecking in 15 minutes. 44. A patient with diabetic neuropathy asks why they should avoid tight shoes. What is the nurse's best response? Answer: tight shoes can cause pressure injuries and infections. Rationale: neuropathy reduces sensation, making pressure injuries from tight shoes less noticeable, increasing infection and ulcer risk. 45. A nurse is preparing to administer insulin glargine and regular insulin. How should they be given? Answer: in separate syringes. Rationale: glargine cannot be mixed with other insulins due to its unique pH, which could alter its action and affect glucose control. 46. A patient with diabetes reports blurred vision after a blood glucose of 400 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia affecting the lens. Rationale: high glucose causes lens swelling, leading to temporary blurred vision. Controlling glucose levels typically resolves this symptom. 47. A nurse is educating a patient about metformin. What labs should be monitored regularly? Answer: renal function tests. Rationale: metformin is cleared by the kidneys, and impaired renal function increases the risk of lactic acidosis, requiring regular monitoring. 48. A patient with type 1 diabetes is sweating and irritable with a blood glucose of 50 milligrams per deciliter. What is the nurse's priority? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: symptoms and low glucose confirm hypoglycemia. Fast-acting carbohydrates quickly raise glucose to prevent further deterioration. 49. A patient with a diabetic foot ulcer has increased redness and warmth. What should the nurse do? Answer: notify the healthcare provider immediately. Rationale: redness and warmth suggest infection, which can escalate rapidly in diabetic patients, requiring urgent medical evaluation. 50. A nurse is teaching a patient about insulin storage during travel. What is the correct advice? Answer: keep insulin at room temperature or in a cooler. Rationale: opened insulin is stable at room temperature for 28 days, but should not be exposed to extreme heat or freezing, making a cooler ideal for travel. 51. A patient with type 2 diabetes asks about the purpose of HbA1c testing. What should the nurse explain? Answer: it measures average blood glucose over 2 to 3 months. Rationale: HbA1c reflects long-term glucose control, guiding treatment adjustments to prevent complications like neuropathy or retinopathy. 52. A patient with diabetes has a blood glucose of 600 milligrams per deciliter and is lethargic. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: Extreme hyperglycemia and lethargy suggest HHS, requiring for fluids, insulin, and electrolyte management to stabilize the patient. 53. A nurse is reviewing a patient's insulin pump settings. What should the nurse ensure? Answer: the basal and bolus doses are correctly programmed. Rationale: proper pump settings ensure continuous basal insulin and appropriate bolus doses for meals, maintaining optimal glucose control. 54. A patient with diabetes reports frequent urination and thirst. What should the nurse assess first? Answer: blood glucose level. Rationale: polyuria and polydipsia are classic hyperglycemia symptoms, requiring glucose assessment to confirm and guide treatment. 55. A nurse is teaching a patient about preventing diabetic foot complications. What is a key instruction? Answer: avoid walking barefoot. Rationale: walking barefoot increases the risk of injury, especially with neuropathy, leading to infections or ulcers in diabetic patients. 56. A patient with type 1 diabetes has a blood glucose of 250 milligrams per deciliter before exercise. What should the nurse advise? Answer: delay exercise and check for ketones. Rationale: glucose above 250 milligrams per deciliter before exercise may indicate insulin deficiency, and ketones suggest risk of DKA, requiring caution. 57. A nurse is administering insulin to a patient with a blood glucose of 80 milligrams per deciliter. What should the nurse confirm? Answer: the patient has eaten or will eat soon. Rationale: administering insulin without food at a normal glucose level risks hypoglycemia, so meal timing must be confirmed. 58. A patient with diabetes asks about the role of fiber in their diet. What should the nurse explain? Answer: it helps stabilize blood glucose levels. Rationale: dietary fiber slows glucose absorption, reducing postprandial spikes and aiding in long-term glucose control. 59. A patient with a blood glucose of 45 milligrams per deciliter is confused. What should the nurse do first? Answer: administer glucagon if unable to swallow safely. Rationale: confusion indicates severe hypoglycemia. If the patient cannot safely swallow carbohydrates, glucagon is needed to raise glucose. 60. A nurse is teaching a patient about insulin pen use. What is a critical step? Answer: prime the pen before each injection. Rationale: priming removes air bubbles and ensures accurate dosing, preventing under- or overdosing of insulin. 61. A patient with type 2 diabetes is prescribed pioglitazone. What should the nurse monitor for? Answer: signs of heart failure. Rationale: pioglitazone can cause fluid retention, increasing heart failure risk, necessitating monitoring for edema or shortness of breath. 62. A patient with diabetes has a callus on their foot. What should the nurse advise? Answer: consult a podiatrist for safe removal. Rationale: calluses can hide ulcers or lead to pressure injuries. Professional removal prevents complications in diabetic patients. 63. A nurse is caring for a patient with DKA receiving for insulin. What indicates improvement? Answer: decreasing blood glucose and resolving acidosis. Rationale: effective DKA treatment lowers glucose and corrects acidosis, e.g., rising pH or falling anion gap, indicating metabolic stabilization. 64. A patient with diabetes asks about stress management. Why is this important? Answer: stress can raise blood glucose levels. Rationale: stress hormones like cortisol increase glucose production, potentially worsening control, so stress management is key. 65. A nurse is teaching a patient about sick day rules. What should the patient do if unable to eat? Answer: sip carbohydrate-containing fluids and check glucose. Rationale: maintaining carbohydrate intake and frequent monitoring prevent hypoglycemia or DKA during illness when eating is difficult. 66. A patient with type 1 diabetes reports weight loss despite increased appetite. What should the nurse suspect? Answer: uncontrolled hyperglycemia. Rationale: weight loss and polyphagia suggest insulin deficiency, leading to glucose loss in urine and tissue breakdown, requiring evaluation. 67. A nurse is preparing to administer insulin detamir. What should the nurse know about its duration? Answer: it lasts up to 24 hours. Rationale: detamir is a long-acting insulin providing basal coverage for up to 24 hours, administered once or twice daily based on need. 68. A patient with diabetes has a blood glucose of 90 milligrams per deciliter before bed. What should the nurse recommend? Answer: eat a small snack with protein and carbohydrates. Rationale: a bedtime snack prevents nocturnal hypoglycemia, especially if glucose is near the lower normal range, 70 to 130 mg/dl. 69. A nurse is teaching a patient about continuous glucose monitoring, CGM. What is a benefit? Answer: it provides real-time glucose trends. Rationale: CGM tracks glucose continuously, helping patients adjust insulin, diet, or activity to prevent hypo or hyperglycemia. 70. A patient with a diabetic foot ulcer reports fever and chills. What should the nurse do? Answer: notify the provider and prepare for wound culture. Rationale: fever and chills suggest systemic infection, requiring urgent evaluation, possible antibiotics, and wound culture to guide treatment. 71. A nurse is reviewing a patient's insulin regimen. The patient takes NPH and regular insulin. How should they be mixed? Answer: draw regular insulin first, then NPH. Rationale: drawing clear regular insulin before cloudy NPH prevents contamination of the regular insulin vial, ensuring accurate dosing. 72. A patient with diabetes asks about preventing retinopathy. What should the nurse emphasize? Answer: maintain tight glucose control and regular eye exams. Rationale: good glucose control slows retinopathy progression, and regular exams detect changes early, preserving vision. 73. A patient with type 2 diabetes reports leg cramps at night. What should the nurse assess? Answer: electrolyte levels and neuropathy. Rationale: cramps may result from diabetic neuropathy or electrolyte imbalances, e.g., hypomagnesemia, common in diabetes, requiring evaluation. 74. A nurse is teaching a patient about glucagon use. When should it be administered? Answer: for severe hypoglycemia when the patient cannot swallow. Rationale: glucagon is used in emergencies when a patient is unconscious or unable to take oral carbohydrates, raising glucose via glycogenolysis. 75. A patient with diabetes has a blood glucose of 180 milligrams per deciliter before a meal. What should the nurse do? Answer: administer insulin as prescribed and monitor. Rationale: premeal glucose of 180 milligrams per deciliter is elevated. Administering prescribed insulin, e.g., bolus, and monitoring prevents further hyperglycemia. 76. A nurse is educating a patient about diabetic nephropathy. What is a key prevention strategy? Answer: control blood pressure and glucose levels. Rationale: hypertension and hyperglycemia accelerate kidney damage. Tight control of both reduces nephropathy risk and progression. 77. A patient with type 1 diabetes is vomiting and has a blood glucose of 350 milligrams per deciliter. What should the nurse do? Answer: check for ketones and notify the provider. Rationale: vomiting and hyperglycemia suggest possible DKA, especially with ketones, requiring urgent evaluation and treatment. 78. A nurse is teaching a patient about insulin injection sites. What is the fastest absorbing site? Answer: abdomen. Rationale: the abdomen has consistent subcutaneous tissue and blood flow, allowing faster insulin absorption compared to arms or thighs. 79. A patient with diabetes reports tingling in their hands. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: tingling is a common symptom of diabetic neuropathy caused by nerve damage from chronic hyperglycemia, requiring assessment. 80. A nurse is caring for a patient with hypoglycemia who is now alert after treatment. What should the nurse do next? Answer: provide a snack with protein and carbohydrates. Rationale: after correcting hypoglycemia, a balanced snack stabilizes glucose levels, preventing recurrence until the next meal. 81. A patient with type 2 diabetes is prescribed a GLP-1 agonist. What is a common side effect? Answer: nausea. Rationale: GLP-1 agonists, e.g., liraglutide, commonly cause nausea, especially initially, which often subsides with continued use. 82. A nurse is teaching a patient about diabetic meal planning. What is a key principle? Answer: balance carbohydrates, proteins, and fats. Rationale: balanced meals stabilize glucose by providing steady energy, preventing spikes or drops, and supporting overall nutrition. 83. A patient with diabetes has a blood glucose of 700 milligrams per deciliter and altered mental status. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: extreme hyperglycemia and mental status changes indicate HHS, requiring for fluids, insulin, and electrolyte correction. 84. A nurse is assessing a patient's insulin injection technique. What indicates a need for reteaching? Answer: injecting into the same site repeatedly. Rationale: repeated injections in one site cause lipohypertrophy, impairing absorption and glucose control, requiring site rotation. 85. A patient with diabetes asks about weight management. What should the nurse recommend? Answer: regular exercise and portion control. Rationale: exercise and portion control promote weight loss, improving insulin sensitivity and glucose control in diabetes. 86. A nurse is caring for a patient with DKA. What electrolyte imbalance is most likely? Answer: hypokalemia during treatment. Rationale: insulin and fluid therapy for DKA shift potassium into cells, causing hypokalemia, which requires careful monitoring. 87. A patient with type 1 diabetes reports missing a dose of insulin. What should the nurse assess for? Answer: signs of hyperglycemia or DKA. Rationale: missing insulin can cause hyperglycemia, potentially progressing to DKA, requiring assessment of glucose and symptoms. 88. A nurse is teaching a patient about preventing hypoglycemia. What is a key strategy? Answer: eat meals and snacks on a regular schedule. Rationale: consistent meal timing ensures steady glucose availability, reducing hypoglycemia risk, especially with insulin or sulfonylureas. 89. A patient with diabetes has a fungal infection under their toenail. What should the nurse advise? Answer: consult a podiatrist or provider for treatment. Rationale: fungal infections in diabetic patients can worsen or spread, requiring professional treatment to prevent complications. 90. A nurse is reviewing a patient's glucose log. What pattern requires intervention? Answer: morning glucose consistently above 200 milligrams per deciliter. Rationale: elevated fasting glucose, e.g., dawn phenomenon or inadequate basal insulin, indicates poor overnight control, requiring regimen adjustment. 91. A patient with type 1 diabetes has a blood glucose of 550 milligrams per deciliter and is vomiting. What should the nurse prioritize? Answer: assess for ketones and notify the provider. Rationale: vomiting and severe hyperglycemia suggest diabetic ketoacidosis, DK, requiring immediate ketone testing and provider intervention. 92. A nurse is teaching a patient about insulin lispro. What should the patient understand about its use? Answer: it is taken just before or after meals. Rationale: lispro is rapid-acting, with an onset of 10 to 15 minutes, making it ideal for controlling postprandial glucose spikes when timed with meals. 93. A patient with type 2 diabetes has a blood glucose of 62 milligrams per deciliter and feels shaky. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia requires 15 grams of fast-acting carbohydrates, e.g., juice, to raise glucose, with rechecking after 15 minutes. 94. A patient with diabetic neuropathy reports a cut on their foot. What should the nurse advise? Answer: clean the wound and seek medical evaluation. Rationale: neuropathy impairs healing and sensation, increasing infection risk. Prompt cleaning and evaluation prevent complications. 95. A nurse is preparing to administer insulin glargine to a patient. What should the nurse ensure? Answer: it is not mixed with other insulins. Rationale: glargine's unique pH makes it incompatible with other insulins, as mixing alters its action, affecting glucose control. 96. A patient with diabetes reports fatigue and a blood glucose of 450 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia. Rationale: fatigue is a common symptom of hyperglycemia caused by glucose buildup and dehydration, requiring assessment and treatment. 97. A patient with type 2 diabetes is on metformin. What should the nurse teach about alcohol use? Answer: limit alcohol to avoid lactic acidosis risk. Rationale: excessive alcohol with metformin increases lactic acidosis risk, a rare but serious complication, necessitating moderation. 98. A patient with diabetes has a blood glucose of 48 milligrams per deciliter and is alert. What is the nurse's priority action? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia in an alert patient requires 15 grams of carbohydrates to raise glucose safely, followed by monitoring. 99. A patient with a diabetic foot ulcer reports pain and swelling. What should the nurse do? Answer: notify the provider and elevate the foot. Rationale: pain and swelling suggest infection or worsening ulcer, requiring urgent evaluation. Elevation reduces swelling pending assessment. 100. A nurse is teaching a patient about insulin vials. How should open vials be stored? Answer: at room temperature for up to 28 days. Rationale: opened insulin is stable at room temperature for 28 days, ensuring convenience while maintaining potency if not exposed to extremes. 101. A patient with type 2 diabetes asks why exercise is important. What should the nurse explain? Answer: it improves insulin sensitivity and glucose control. Rationale: exercise enhances muscle glucose uptake, reducing insulin resistance and helping maintain stable blood glucose levels. 102. A patient with diabetes has a blood glucose of 650 milligrams per deciliter and confusion. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: confusion and extreme hyperglycemia indicate HHS, requiring for fluids, insulin, and electrolyte management to stabilize. 103. A nurse is reviewing a patient's insulin pump. What should the nurse check regularly? Answer: infusion site for redness or infection. Rationale: pump sites can become infected or irritated, impairing insulin delivery, so regular inspection ensures effective therapy. 104. A patient with diabetes reports increased thirst and a blood glucose of 300 milligrams per deciliter. What should the nurse do? Answer: administer insulin as prescribed and encourage hydration. Rationale: polydipsia and hyperglycemia require insulin to lower glucose and fluids to correct dehydration caused by osmotic diuresis. 105. A nurse is teaching a patient about diabetic foot care. What should the patient do daily? Answer: inspect feet for cuts, blisters, or redness. Rationale: daily inspection detects early issues, preventing infections or ulcers, especially in patients with neuropathy. 106. A patient with type 1 diabetes has a blood glucose of 280 milligrams per deciliter before a workout. What should the nurse advise? Answer: check ketones and consider delaying exercise. Rationale: glucose above 250 milligrams per deciliter may indicate insulin deficiency, and ketones increase DKA risk during exercise, requiring caution. 107. A nurse is administering insulin to a patient with a blood glucose of 85 milligrams per deciliter. What should the nurse ensure? Answer: the patient eats soon after injection. Rationale: insulin at a normal glucose level risks hypoglycemia if not followed by food, so meal timing is critical. 108. A patient with diabetes asks about low-carbohydrate diets. What should the nurse explain? Answer: they can help control glucose but need balance. Rationale: low-carb diets reduce glucose spikes but require protein and fat balance to avoid hypoglycemia or nutritional deficiencies. 109. A patient with a blood glucose of 40 milligrams per deciliter is unresponsive. What should the nurse do first? Answer: administer glucagon intramuscularly. Rationale: severe hypoglycemia in an unresponsive patient requires glucagon to raise glucose, as oral carbohydrates are unsafe. 110. A nurse is teaching a patient about insulin pen needles. What ISS should the patient do with used needles? Answer: dispose of them in a sharps container. Rationale: used needles are biohazardous and must be disposed of safely in a sharps container to prevent injury or infection. 111. A patient with type 2 diabetes is prescribed exenatide. What should the nurse monitor for? Answer: gastrointestinal side effects like nausea. Rationale: exenatide, a GLP-1 agonist, commonly causes nausea or vomiting, especially initially, requiring monitoring for tolerance. 112. A patient with diabetes has a thick callus on their toe. What should the nurse advise? Answer: see a podiatrist for professional removal. Rationale: calluses can hide ulcers or cause pressure injuries, requiring safe removal by a specialist to prevent complications. 113. A nurse is caring for a patient with DKA. What lab value indicates resolution? Answer: closing anion gap. Rationale: a normalized anion gap indicates resolution of acidosis in DKA, reflecting restored metabolic balance after treatment. 114. A patient with diabetes asks about meditation. How does it help? Answer: it reduces stress and stabilizes glucose levels. Rationale: stress raises glucose via cortisol. Meditation lowers stress, helping maintain better glucose control. 115. A nurse is teaching a patient about sick day management. What fluid should they drink if nauseated? Answer: clear liquids with carbohydrates like sports drinks. Rationale: clear liquids with carbohydrates maintain hydration and glucose levels during illness, preventing hypoglycemia or DKA. 116. A patient with type 1 diabetes reports unintentional weight loss. What should the nurse assess? Answer: blood glucose and ketone levels. Rationale: unexplained weight loss may indicate uncontrolled hyperglycemia or DKA, requiring glucose and ketone evaluation. 117. A nurse is preparing to administer insulin detamir. What is its primary function? Answer: provide basal insulin coverage. Rationale: detamir is a long-acting insulin, maintaining steady glucose control over 24 hours as a basal dose. 118. A patient with diabetes has a blood glucose of 95 milligrams per deciliter at bedtime. What should the nurse suggest? Answer: eat a small, balanced snack. Rationale: a bedtime snack with protein and carbohydrates prevents nocturnal hypoglycemia, especially with near-normal glucose. 119. A nurse is teaching a patient about continuous glucose monitors, CGMs. What should they check? Answer: sensor site for irritation or adhesion. Rationale: CGM sensors can cause skin irritation or detach, affecting accuracy, so regular site checks are essential. 120. A patient with a diabetic foot ulcer has a fever. What should the nurse prioritize? Answer: notify the provider and obtain a wound culture. Rationale: fever suggests infection, requiring urgent evaluation and culture to identify pathogens and guide antibiotic therapy. 121. A nurse is mixing NPH and regular insulin. What is the correct order? Answer: draw regular insulin first, then NPH. Rationale: drawing clear regular insulin before cloudy NPH prevents contamination of the regular insulin vial, ensuring accurate dosing. 122. A patient with diabetes asks about preventing vision loss. What should the nurse emphasize? Answer: control glucose and get annual eye exams. Rationale: tight glucose control slows retinopathy and annual exams detect early changes, preventing progression to blindness. 123. A patient with type 2 diabetes reports muscle aches. What should the nurse assess? Answer: electrolyte imbalances or statin use. Rationale: muscle aches may indicate electrolyte issues, e.g., hypokalemia, or statin side effects common in diabetes, requiring evaluation. 124. A nurse is teaching a patient about glucagon kits. Who should be trained to use it? Answer: family members or close contacts. Rationale: glucagon is used for severe hypoglycemia when the patient is unresponsive, so caregivers need training to administer it. 125. A patient with diabetes has a blood glucose of 170 milligrams per deciliter before lunch. What should the nurse do? Answer: administer insulin as prescribed. Rationale: a premeal glucose of 170 milligrams per deciliter is elevated, requiring prescribed insulin, e.g., bolus, to normalize postprandial levels. 126. A nurse is teaching a patient about diabetic kidney disease. What reduces risk? Answer: control blood pressure and glucose. Rationale: hypertension and hyperglycemia damage kidneys. Tight control of both slows nephropathy progression. 127. A patient with type 1 diabetes has diarrhea and a blood glucose of 400 milligrams per deciliter. What should the nurse do? Answer: check ketones and encourage hydration. Rationale: diarrhea and hyperglycemia increase DKA risk. Ketone testing and fluids prevent dehydration and worsening acidosis. 128. A nurse is teaching a patient about insulin injection depth. What is the correct technique? Answer: inject into subcutaneous tissue, not muscle. Rationale: subcutaneous injection ensures proper insulin absorption. Intramuscular injection causes rapid, unpredictable effects. 129. A patient with diabetes reports hand numbness. What should the nurse suspect? Answer: peripheral neuropathy or cardiac tunnel syndrome. Rationale: numbness may indicate diabetic neuropathy or cardiac tunnel, both common in diabetes, requiring further assessment. 130. A patient with hypoglycemia is alert after treatment. What should the nurse provide next? Answer: a snack with protein and carbohydrates. Rationale: a balanced snack after hypoglycemia treatment stabilizes glucose, preventing recurrence until the next meal. 131. A patient with type 2 diabetes is prescribed sitagliptin. What is its mechanism? Answer: increases incretin levels to boost insulin release. Rationale: sitagliptin, a DPP for inhibitor, enhances incretin activity, promoting glucose-dependent insulin secretion and reducing glucagon. 132. A nurse is teaching a patient about glycemic index. What foods should they prioritize? Answer: low glycemic index foods like whole grains. Rationale: low GI foods cause slower glucose rises, improving control and reducing postprandial spikes in diabetes. 133. A patient with diabetes has a blood glucose of 750 milligrams per deciliter and drowsiness. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: drowsiness and extreme hyperglycemia indicate HHS, requiring urgent fluids, insulin, and electrolyte correction. 134. A nurse observes a patient pinching skin during insulin injection. What should the nurse clarify? Answer: pinch only if subcutaneous tissue is thin. Rationale: pinching ensures subcutaneous delivery in lean patients, but is unnecessary in those with adequate fat, risking muscle injection. 135. A patient with diabetes asks about portion control. Why is it important? Answer: it prevents glucose spikes and aids weight management. Rationale: proper portions reduce carbohydrate overload, stabilizing glucose and supporting weight control, key in diabetes. 136. A nurse is caring for a patient with DKA. What fluid is typically ordered? Answer: 0.9% normal saline initially. Rationale: normal saline corrects dehydration in DKA, restoring volume before transitioning to glucose-containing fluids as needed. 137. A patient with type 1 diabetes forgot their morning insulin. What should the nurse monitor for? Answer: hyperglycemia or ketone production. Rationale: missing insulin causes glucose buildup and potential ketogenesis, risking DKA, requiring close monitoring. 138. A nurse is teaching a patient about preventing hypoglycemia at night. What should they do? Answer: check glucose and eat a bedtime snack if low. Rationale: monitoring and a balanced snack prevent nocturnal hypoglycemia, especially if evening glucose is near normal. 139. A patient with diabetes has a fungal rash in their toe web spaces. What should the nurse advise? Answer: keep the area dry and consult a provider. Rationale: fungal infections thrive in moist areas and can worsen in diabetes, requiring antifungal treatment and hygiene. 140. A nurse is reviewing a patient's glucose log showing high evening readings. What should the nurse explore? Answer: evening meal portions or insulin dosing. Rationale: high evening glucose may reflect excessive carbohydrate intake or inadequate insulin, requiring dietary or regimen adjustments. 141. A patient with type 1 diabetes has a blood glucose of 600 milligrams per deciliter and fruity breath. What should the nurse prioritize? Answer: notify the provider and prepare for DKA treatment. Rationale: fruity breath and severe hyperglycemia indicate diabetic ketoacidosis, DKA, requiring urgent insulin, fluids, and provider intervention. 142. A nurse is teaching a patient about insulin glucosine, Apidra. When should it be administered? Answer: within 15 minutes before or after meal. Rationale: glucosine is a rapid-acting insulin with a 10-15-minute onset, timed with meals to control postprandial glucose spikes. 143. A patient with type 2 diabetes has a blood glucose of 58 milligrams per deciliter and is sweaty. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia requires 15 grams of fast-acting carbohydrates, e.g., glucose tablets, to raise glucose, with rechecking after 15 minutes. 144. A patient with diabetic neuropathy reports a new sore on their foot. What should the nurse advise? Answer: avoid weight-bearing and seek medical care. Rationale: neuropathy impairs healing, and sores can worsen rapidly. Offloading pressure and prompt care prevent infection or ulceration. 145. A nurse is preparing insulin detamir and aspart for a patient. How should they be given? Answer: in separate injections. Rationale: detamir, long-acting, and aspart, rapid-acting, cannot be mixed, as mixing alters their pharmacokinetics, affecting glucose control. 146. A patient with diabetes reports headache and a blood glucose of 420 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia. Rationale: headache is a symptom of hyperglycemia, caused by dehydration and glucose overload, requiring insulin and fluid management. 147. A patient with type 2 diabetes on metformin is scheduled for a CT scan with contrast. What should the nurse do? Answer: hold metformin and notify the provider. Rationale: contrast dye can impair renal function, increasing metformin-related lactic acidosis risk, so it's typically held for 48 hours. 148. A patient with diabetes has a blood glucose of 52 milligrams per deciliter and is alert. What is the nurse's priority? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia in an alert patient requires 15 grams of carbohydrates to raise glucose safely, followed by rechecking. 149. A patient with a diabetic foot ulcer has warmth and pus. What should the nurse do? Answer: notify the provider and prepare for wound assessment. Rationale: warmth and pus indicate infection, requiring urgent evaluation, possible debridement, and antibiotics in diabetic patients. 150. A nurse is teaching a patient about insulin pens. What should they do before injecting? Answer: check the insulin type and prime the pen. Rationale: verifying insulin type prevents errors, and priming ensures accurate dosing by removing air from the needle. 151. A patient with type 2 diabetes asks about HbA1c goals. What should the nurse explain? Answer: aim for less than 7% for most patients. Rationale: an HbA1c below 7% indicates good long-term glucose control, reducing complication risks, though goals vary by patient. 152. A patient with diabetes has a blood glucose of 700 milligrams per deciliter and is drowsy. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: drowsiness and extreme hyperglycemia suggest HHS, requiring for fluids, insulin, and electrolyte correction. 153. A nurse is inspecting a patient's insulin pump site. What finding requires action? Answer: redness and swelling at the insertion site. Rationale: redness and swelling suggest infection or irritation, which can impair insulin delivery, requiring site change and evaluation. 154. A patient with diabetes reports frequent urination and a blood glucose of 350 milligrams per deciliter. What should the nurse do? Answer: administer insulin as ordered and monitor fluids. Rationale: polyuria and hyperglycemia indicate osmotic diuresis, requiring insulin to lower glucose and fluids to prevent dehydration. 155. A nurse is teaching a patient about diabetic foot hygiene. What should they avoid? Answer: using heating pads on feet. Rationale: heating pads can cause burns, especially with neuropathy, increasing infection risk in diabetic patients. 156. A patient with type 1 diabetes has a blood glucose of 300 milligrams per deciliter before exercise. What should the nurse advise? Answer: test for ketones and avoid exercise if positive. Rationale: glucose above 250 milligrams per deciliter with ketones increases DKA risk during exercise, requiring insulin adjustment first. 157. A nurse is giving insulin to a patient with a blood glucose of 90 milligrams per deciliter. What should the nurse confirm? Answer: the patient will eat soon after. Rationale: insulin at a normal glucose level risks hypoglycemia without food, so meal timing must be confirmed. 158. A patient with diabetes asks about plant-based diets. What should the nurse explain? Answer: they can improve glucose control if balanced. Rationale: plant-based diets reduce insulin resistance, but need adequate protein and nutrients to prevent hypoglycemia or deficiencies. 159. A patient with a blood glucose of 45 milligrams per deciliter is seizing. What should the nurse do first? Answer: administer glucagon or 4-dextrose. Rationale: seizures from severe hypoglycemia require glucagon or 4-dextrose, as oral carbohydrates are unsafe during seizures. 160. A nurse is teaching a patient about insulin syringe disposal. What is the correct method? Answer: place used syringes in a sharps container. Rationale: syringes are biohazardous, requiring safe disposal in a sharps container to prevent injury or contamination. 161. A patient with type 2 diabetes is prescribed empagliflozin. What should the nurse monitor for? Answer: signs of dehydration or urinary infections. Rationale: empagliflozin, an SGLT2 inhibitor, increases glucose excretion, raising risks of dehydration and urinary tract infections. 162. A patient with diabetes has a corn on their foot. What should the nurse advise? Answer: avoid over-the-counter removers and see a podiatrist. Rationale: chemical removers can cause skin breakdown, and corns may hide ulcers, requiring professional care in diabetes. 163. A nurse is caring for a patient with DKA. What indicates treatment effectiveness? Answer: rising pH and falling glucose levels. Rationale: effective DKA treatment corrects acidosis, increases pH, and lowers glucose, indicating metabolic stabilization. 164. A patient with diabetes asks about yoga. How does it benefit them? Answer: it reduces stress and improves glucose control. Rationale: yoga lowers cortisol, which can raise glucose, aiding in better diabetes management alongside physical benefits. 165. A nurse is teaching a patient about sick day rules. What should they do if vomiting? Answer: sip small amounts of carbohydrate fluids and test glucose. Rationale: small sips maintain glucose and hydration, while frequent testing prevents DKA or hypoglycemia during illness. 166. A patient with type 1 diabetes reports increased hunger and fatigue. What should the nurse assess? Answer: blood glucose for hyperglycemia. Rationale: polyphagia and fatigue suggest uncontrolled hyperglycemia, requiring glucose testing to guide treatment. 167. A nurse is preparing to administer insulin glargine. What is its duration of action? Answer: up to 24 hours. Rationale: glargine is a long-acting insulin providing basal coverage for 24 hours, typically given once daily. 168. A patient with diabetes has a blood glucose of 80 milligrams per deciliter at bedtime. What should the nurse suggest? Answer: eat a snack with protein and carbohydrates. Rationale: a balanced snack prevents nocturnal hypoglycemia, especially with near-normal glucose levels. 169. A nurse is teaching a patient about CGM alarms. What should they do if it signals low glucose? Answer: check fingerstick glucose and treat if confirmed. Rationale: CGM alarms may be inaccurate, so confirming with a fingerstick ensures appropriate treatment for hypoglycemia. 170. A patient with a diabetic foot ulcer has swelling and odor. What should the nurse do? Answer: notify the provider and prepare for wound culture. Rationale: swelling and odor suggest infection, requiring urgent evaluation and culture to guide antibiotic therapy. 171. A nurse is drawing up regular and NPH insulin. What should be drawn first? Answer: regular insulin. Rationale: drawing clear regular insulin before cloudy NPH prevents contamination of the regular insulin vial, ensuring accuracy. 172. A patient with diabetes asks about preventing blindness. What should the nurse recommend? Answer: tight glucose control and regular eye exams. Rationale: good glucose control slows retinopathy, and exams detect early changes, preventing vision loss. 173. A patient with type 2 diabetes reports joint pain. What should the nurse assess? Answer: medication side effects or neuropathy. Rationale: joint pain may stem from diabetes complications like neuropathy or medications, e.g., DPP for inhibitors, requiring evaluation. 174. A nurse is teaching a patient about glucagon storage. Where should it be kept? Answer: at room temperature, away from heat. Rationale: glucagon remains stable at room temperature but degrades with heat, ensuring it's effective for emergencies. 175. A patient with diabetes has a blood glucose of 160 milligrams per deciliter before dinner. What should the nurse do? Answer: administer insulin as prescribed. Rationale: a premeal glucose of 160 milligrams per deciliter is elevated, requiring prescribed bolus insulin to control postprandial levels. 176. A nurse is teaching a patient about diabetic neuropathy. What reduces its progression? Answer: maintain tight glucose control. Rationale: chronic hyperglycemia damages nerves, so tight control slows neuropathy progression and symptom worsening. 177. A patient with type 1 diabetes has nausea and a blood glucose of 380 milligrams per deciliter. What should the nurse do? Answer: test for ketones and notify the provider. Rationale: nausea and hyperglycemia suggest possible DKA, requiring ketone testing and urgent medical evaluation. 178. A nurse is teaching a patient about insulin injection sites. Why rotate sites? Answer: to prevent lipohypertrophy. Rationale: repeated injections in one area cause fat buildup, lipohypertrophy, impairing insulin absorption and glucose control. 179. A patient with diabetes reports foot tingling. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: tingling is a hallmark of diabetic neuropathy caused by nerve damage from hyperglycemia, requiring further assessment. 180. A patient with hypoglycemia is now stable after treatment. What should the nurse provide? Answer: a balanced snack with protein and carbohydrates. Rationale: a snack stabilizes glucose after hypoglycemia, preventing recurrence until the next scheduled meal. 181. A patient with type 2 diabetes is prescribed dulaglutide. What is a common side effect? Answer: nausea or vomiting. Rationale: dulaglutide, a GLP-1 agonist, often causes gastrointestinal upset initially, which typically improves over time. 182. A nurse is teaching a patient about meal timing with insulin. Why is it important? Answer: to prevent hypoglycemia or hyperglycemia. Rationale: timing meals with insulin ensures glucose availability matches insulin action, balancing blood glucose levels. 183. A patient with diabetes has a blood glucose of 800 milligrams per deciliter and is lethargic. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: lethargy and extreme hyperglycemia indicate HHS, requiring urgent fluids, insulin, and electrolyte management. 184. A nurse observes a patient reusing insulin needles. What should the nurse teach? Answer: use a new needle for each injection. Rationale: reusing needles increases infection risk and dulls the needle, causing pain and inconsistent insulin delivery. 185. A patient with diabetes asks about exercise timing. When is it safest? Answer: after meals when glucose is stable. Rationale: post-meal exercise uses available glucose, reducing hypoglycemia risk compared to fasting exercise. 186. A nurse is caring for a patient with DKA. What potassium issue should be monitored? Answer: hypokalemia during treatment. Rationale: insulin and fluids shift potassium into cells, causing hypokalemia, which can lead to arrhythmias if unmonitored. 187. A patient with type 1 diabetes missed their evening insulin. What should the nurse assess? Answer: signs of hyperglycemia or DKA. Rationale: missing insulin causes glucose and ketone buildup, potentially leading to DKA, requiring symptom and lab assessment. 188. A nurse is teaching a patient about preventing hypoglycemia. What is a key habit? Answer: carry a fast-acting carbohydrate source. Rationale: having glucose tablets or juice available allows rapid treatment of hypoglycemia, preventing severe episodes. 189. A patient with diabetes has cracked heels. What should the nurse advise? Answer: moisturize daily and avoid open-toed shoes. Rationale: moisturizing prevents skin breakdown, and closed shoes protect cracked heels from infection in diabetic patients. 190. A nurse is reviewing a patient's glucose log with high morning readings. What might this indicate? Answer: dawn phenomenon or inadequate basal insulin. Rationale: morning hyperglycemia may reflect hormonal glucose surges, dawn phenomenon, or insufficient overnight insulin, needing adjustment. 191. A patient with type 1 diabetes has a blood glucose of 520 milligrams per deciliter and reports nausea. What should the nurse prioritize? Answer: check for ketones and notify the provider. Rationale: nausea and severe hyperglycemia suggest diabetic ketoacidosis, DKA, requiring ketone testing and urgent medical intervention. 192. A nurse is teaching a patient about insulin aspart timing. When is it most effective? Answer: just before or after meals. Rationale: aspart, a rapid-acting insulin, has a 10-20-minute onset, aligning with meal-related glucose spikes for optimal control. 193. A patient with type 2 diabetes has a blood glucose of 60 milligrams per deciliter and feels dizzy. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia requires 15 grams of fast-acting carbohydrates, e.g., juice, to raise glucose, with rechecking after 15 minutes. 194. A patient with diabetic neuropathy finds a blister on their toe. What should the nurse advise? Answer: keep it clean and consult a provider. Rationale: neuropathy impairs healing, and blisters can lead to infection. Prompt cleaning and medical evaluation prevent complications. 195. A nurse is preparing to administer insulin glargine and lispro. How should they be given? Answer: in separate syringes. Rationale: glargine's unique pH makes it incompatible with lispro. Mixing alters their action, compromising glucose control. 196. A patient with diabetes reports thirst and a blood glucose of 400 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia. Rationale: thirst, polydipsia, is a classic hyperglycemia symptom caused by dehydration from osmotic diuresis, requiring treatment. 197. A patient with type 2 diabetes on metformin has a procedure with contrast dye. What should the nurse do? Answer: hold metformin for 48 hours post-procedure. Rationale: contrast dye can impair renal function, increasing metformin-related lactic acidosis risk, so it's held temporarily. 198. A patient with diabetes has a blood glucose of 50 milligrams per deciliter and is alert. What is the nurse's priority? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia in an alert patient requires 15 grams of carbohydrates to raise glucose safely, followed by monitoring. 199. A patient with a diabetic foot ulcer reports increased pain and redness. What should the nurse do? Answer: notify the provider and assess for infection. Rationale: pain and redness suggest infection, which can escalate quickly in diabetic patients, requiring urgent evaluation. 200. A nurse is teaching a patient about insulin vial storage. How long can open vials be used? Answer: up to 28 days at room temperature. Rationale: opened insulin remains stable for 28 days at room temperature, ensuring potency if protected from extreme heat or cold. 201. A patient with type 2 diabetes asks why weight loss is recommended. What should the nurse explain? Answer: it improves insulin sensitivity and glucose control. Rationale: weight loss reduces insulin resistance, enhancing glucose uptake and lowering blood glucose levels effectively. 202. A patient with diabetes has a blood glucose of 750 milligrams per deciliter and altered mental status. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: altered mental status and extreme hyperglycemia indicate HHS, requiring for fluids, insulin, and electrolyte correction. 203. A nurse is checking a patient's insulin pump. What should be inspected regularly? Answer: tubing for kinks or leaks. Rationale: kinks or leaks in pump tubing can disrupt insulin delivery, leading to hyperglycemia, so regular checks are essential. 204. A patient with diabetes reports frequent urination and a blood glucose of 320 milligrams per deciliter. What should the nurse do? Answer: administer insulin as ordered and encourage fluids. Rationale: polyuria and hyperglycemia indicate osmotic diuresis, requiring insulin to lower glucose and fluids to rehydrate. 205. A nurse is teaching a patient about diabetic foot care. What should they avoid? Answer: cutting toenails with scissors. Rationale: improper nail cutting can cause injury, especially with neuropathy, increasing infection risk. Clippers or podiatrists are safer. 206. A patient with type 1 diabetes has a blood glucose of 270 milligrams per deciliter before exercise. What should the nurse advise? Answer: check ketones and delay exercise if positive. Rationale: glucose above 250 milligrams per deciliter with ketones increases DKA risk during exercise, requiring insulin correction first. 207. A nurse is administering insulin to a patient with a blood glucose of 88 milligrams per deciliter. What should the nurse confirm? Answer: the patient will eat soon. Rationale: insulin at a normal glucose level risks hypoglycemia without food, so meal timing must be verified. 208. A patient with diabetes asks about high-protein diets. What should the nurse explain? Answer: they can aid glucose control but need monitoring. Rationale: high-protein diets stabilize glucose but may stress kidneys and diabetes, requiring balanced intake and renal monitoring. 209. A patient with a blood glucose of 42 milligrams per deciliter is confused. What should the nurse do first? Answer: administer glucagon if unable to swallow. Rationale: confusion indicates severe hypoglycemia. Glucagon is needed if oral carbohydrates are unsafe due to altered mental status. 210. A nurse is teaching a patient about insulin pen maintenance. What should they check? Answer: the pen for air bubbles before injection. Rationale: air bubbles can reduce dose accuracy, leading to poor glucose control, so priming removes them before injection. 211. A patient with type 2 diabetes is prescribed canagliflozin. What should the nurse monitor? Answer: signs of genital infections or dehydration. Rationale: canagliflozin, an SGLT2 inhibitor, increases infection and dehydration risks due to glucose excretion in urine. 212. A patient with diabetes has a pressure sore on their heel. What should the nurse advise? Answer: offload pressure and consult a wound specialist. Rationale: pressure sores in diabetic patients can worsen rapidly, requiring offloading and specialist care to prevent ulcers. 213. A nurse is caring for a patient with DKA. What fluid is initially used? Answer: 0.9% normal saline. Rationale: normal saline corrects dehydration in DKA, restoring volume before glucose-containing fluids are introduced. 214. A patient with diabetes asks about sleep's impact on glucose. What should the nurse explain? Answer: poor sleep can raise glucose levels. Rationale: sleep deprivation increases stress hormones like cortisol, elevating glucose, so good sleep supports diabetes control. 215. A nurse is teaching a patient about sick day management. What if they can't eat solids? Answer: consume carbohydrate-containing liquids. Rationale: liquids like juice or broth maintain glucose and hydration, preventing hypoglycemia or DKA during illness. 216. A patient with type 1 diabetes reports thirst and weight loss. What should the nurse assess? Answer: blood glucose and ketones. Rationale: thirst and weight loss suggest hyperglycemia or DKA, requiring glucose and ketone testing to guide treatment. 217. A nurse is preparing to administer insulin detamir. What is its onset of action? Answer: 1 to 2 hours. Rationale: detamir is a long-acting insulin with a slow onset, providing steady basal coverage over 24 hours. 218. A patient with diabetes has a blood glucose of 85 milligrams per deciliter at bedtime. What should the nurse suggest? Answer: eat a small snack with protein and carbohydrates. Rationale: a balanced snack prevents nocturnal hypoglycemia, especially with near-normal glucose levels. 219. A nurse is teaching a patient about CGM calibration. When should it be done? Answer: as per device instructions, often twice daily. Rationale: calibration with fingerstick glucose ensures CGM accuracy, with frequency depending on the device model. 220. A patient with a diabetic foot ulcer has fever and chills. What should the nurse do? Answer: notify the provider and obtain a wound culture. Rationale: fever and chills suggest systemic infection, requiring urgent culture and antibiotics to address wound infection. 221. A nurse is mixing regular and NPH insulin. Why draw regular first? Answer: to avoid contaminating the regular insulin vial. Rationale: drawing cloudy NPH first risks introducing it into the clear regular insulin vial, altering its action. 222. A patient with diabetes asks about preventing retinopathy. What should the nurse emphasize? Answer: strict glucose control and annual eye exams. Rationale: tight control slows retinopathy progression, and exams detect early changes, preserving vision. 223. A patient with type 2 diabetes reports fatigue. What should the nurse assess? Answer: blood glucose and medication adherence. Rationale: fatigue may indicate hypo or hyperglycemia or poor medication adherence, requiring glucose and history evaluation. 224. A nurse is teaching a patient about glucagon use. When is it indicated? Answer: for severe hypoglycemia with inability to swallow. Rationale: glucagon raises glucose in emergencies when oral carbohydrates are unsafe, such as in unconscious patients. 225. A patient with diabetes has a blood glucose of 165 milligrams per deciliter before breakfast. What should the nurse do? Answer: administer insulin as prescribed. Rationale: a premeal glucose of 165 milligrams per deciliter is elevated, requiring prescribed bolus insulin to control postprandial levels. 226. A nurse is teaching a patient about diabetic nephropathy prevention. What is key? Answer: control blood pressure and glucose. Rationale: hypertension and hyperglycemia accelerate kidney damage, so tight control reduces nephropathy risk. 227. A patient with type 1 diabetes has vomiting and a blood glucose of 360 milligrams per deciliter. What should the nurse do? Answer: test for ketones and notify the provider. Rationale: vomiting and hyperglycemia suggest DKA, requiring ketone testing and urgent medical intervention. 228. A nurse is teaching a patient about insulin injection angle. What is recommended? Answer: 90 degrees for most, 45 if thin. Rationale: a 90-degree angle ensures subcutaneous delivery, but 45 degrees prevents muscle injection in lean patients. 229. A patient with diabetes reports leg numbness. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: numbness is a common sign of diabetic neuropathy caused by nerve damage from chronic hyperglycemia. 230. A patient with hypoglycemia is alert post-treatment. What should the nurse provide? Answer: a snack with protein and carbohydrates. Rationale: a balanced snack stabilizes glucose after hypoglycemia, preventing recurrence until the next meal. 231. A patient with type 2 diabetes is prescribed allogliptin. What is its action? Answer: enhances insulin secretion via incretin effects. Rationale: allogliptin, a DPP for inhibitor, increases incretin levels, promoting glucose-dependent insulin release. 232. A nurse is teaching a patient about balanced meals. Why are they important? Answer: they stabilize glucose and provide nutrition. Rationale: balanced meals with carbohydrates, proteins, and fats prevent glucose spikes and support overall health. 233. A patient with diabetes has a blood glucose of 820 milligrams per deciliter and confusion. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: confusion and extreme hyperglycemia indicate HHS, requiring urgent fluids, insulin, and electrolyte management. 234. A nurse observes a patient injecting insulin too shallowly. What is the risk? Answer: poor absorption and hyperglycemia. Rationale: shallow injections may not reach subcutaneous tissue, reducing insulin absorption and causing elevated glucose. 235. A patient with diabetes asks about fasting for religious reasons. What should the nurse advise? Answer: consult the provider to adjust medications. Rationale: fasting can cause hypoglycemia or hyperglycemia, requiring medication adjustments to maintain safe glucose levels. 236. A nurse is caring for a patient with DKA. What sodium imbalance is common? Answer: hyponatremia due to osmotic shifts. Rationale: hyperglycemia draws water into the bloodstream, diluting sodium, causing hyponatremia, which requires monitoring. 237. A patient with type 1 diabetes missed their morning insulin. What should the nurse monitor? Answer: hyperglycemia and ketone levels. Rationale: missing insulin leads to glucose and ketone buildup, risking DKA, necessitating close monitoring. 238. A nurse is teaching a patient about preventing nocturnal hypoglycemia. What is key? Answer: check glucose and eat a bedtime snack if needed. Rationale: monitoring and a balanced snack prevent low glucose overnight, especially if evening levels are near normal. 239. A patient with diabetes has dry, itchy feet. What should the nurse advise? Answer: moisturize and avoid scratching. Rationale: moisturizing prevents skin breakdown, and avoiding scratching reduces infection risk in diabetic patients. 240. A nurse is reviewing a patient's glucose log with low afternoon readings. What should the nurse explore? Answer: excessive lunch insulin or activity levels. Rationale: afternoon hypoglycemia may result from too much insulin or increased activity, requiring dose or lifestyle adjustments. 241. A patient with type 1 diabetes has a blood glucose of 580 milligrams per deciliter and reports abdominal pain. What should the nurse prioritize? Answer: assess for diabetic ketoacidosis and notify the provider. Rationale: abdominal pain and severe hyperglycemia suggest DKA, a medical emergency requiring immediate assessment and provider intervention. 242. A nurse is teaching a patient about insulin lispro, Humalog. What is its peak action time? Answer: 1 to 2 hours after injection. Rationale: lispro, a rapid-acting insulin, peaks in 1 to 2 hours, aligning with postprandial glucose rises, requiring meal timing coordination. 243. A patient with type 2 diabetes has a blood glucose of 55 milligrams per deciliter and feels clammy. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia in an alert patient requires 15 grams of fast-acting carbohydrates, e.g., glucose gel, to raise glucose, with rechecking after 15 minutes. 244. A patient with diabetic neuropathy notices swelling in their ankle. What should the nurse advise? Answer: elevate the leg and seek medical evaluation. Rationale: swelling may indicate injury or infection, worsened by neuropathy's poor sensation, requiring elevation and prompt assessment. 245. A nurse is preparing to administer insulin detamir to a patient. What should the nurse know about its administration? Answer: it should be given at the same time daily. Rationale: detamir, a long-acting insulin, provides consistent basal coverage when administered at a fixed time, optimizing glucose control. 246. A patient with diabetes reports blurred vision and a blood glucose of 410 milligrams per deciliter. What should the nurse do? Answer: administer insulin as ordered and monitor vision changes. Rationale: blurred vision is common in hyperglycemia due to lens swelling. Insulin corrects glucose, and monitoring tracks symptom resolution. 247. A patient with type 2 diabetes on metformin reports bloating. What should the nurse suggest? Answer: take it with meals or discuss extended-release options. Rationale: taking metformin with food reduces GI side effects like bloating, and extended-release forms may further improve tolerance. 248. A patient with diabetes has a blood glucose of 48 milligrams per deciliter and is irritable. What is the nurse's priority action? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia with symptoms like irritability requires 15 grams of carbohydrates to raise glucose, followed by rechecking. 249. A patient with diabetes finds a small cut on their foot. What should the nurse teach? Answer: clean it daily and monitor for signs of infection. Rationale: small cuts in diabetic patients can lead to serious infections due to poor healing, requiring diligent care and monitoring. 250. A nurse is teaching a patient about insulin pump therapy. What should the patient report immediately? Answer: pump alarms or delivery interruptions. Rationale: alarms or interruptions indicate potential insulin delivery failure, risking hyperglycemia or DKA, requiring immediate action.